Health Minister Dr. Ampareen Lyngdoh today announced the Meghalaya initiative, a mission-mode program aimed at improving early detection, treatment, and financial aid for cancer patients. It may be mentioned that Meghalaya has one of the highest cancer rates in India, with East Khasi Hills recording 227 cases per lakh individuals, double the national average. The health minister highlighted that cancer screenings have been expanded to district levels. She also mentioned that civil hospitals' bed capacity is increasing to 200. She added that advanced treatments, including PET scans, are now available at NIGRIMS, and MHIS covers all cancer treatments to reduce costs. Lastly, she urged citizens to trust local healthcare and assured of the government's support.
On the commemoration of World Cancer Day 2025, I would like to send a very clear message to all citizens who are in some way or the other affected by the most dreaded disease of the modern generation, one of them at least, and that is cancer. This year, it has been decided that we would focus on individual patients. Therefore, the theme of this year's Cancer Commemoration Day is United by Unique. Not all cancer patients are at the same level of community and society. Each have their own challenges. The disease and its manifestation also has its own unique challenges. Many of these challenges are now ably addressed in the cancer hospital at Civil, and we are very grateful that the NIGRIMS is also now upgrading its facility, where we will likely have important tests that can be again taken up by NIGRIMS. Say, for example, the PET scan and all of these important indicators for treatment of cancer are very much required in the state, and the government is well seized. There are different sets of problems for the different sets of issues that arise because of our inability to attend to treating cancer for every citizen. So we are now also very confident that as a department, we are able to at least test at the district. Earlier, this was a far dream, but today, even our centers in districts are well equipped for the early detection of cancer. Once upon a time, patients suffering from cancer would only know that they were cancer patients at very late stages. But today, cancer patients quickly get tested, quickly get treated, and continue good living, a good life, and live so many years beyond the expectations and beyond the predictions of the medical fraternity. So yes, today this is the situation of cancer in the state of Meghalaya. We are also very happy that Honorable Chief Minister is seized of this problem, and hence today we have already announced a project like Meg Can Care. This Meg Can Care project is on a mission mode and is supported directly by the government of Meghalaya. And we are also very, very happy to share with the people of the state that the MHIS scheme itself is very inclusive. And across the various slabs of the society, everyone has access to this care and the state stands committed in its policy decision have to curb out of pocket expenses, and we are doing the very best to ensure that we are there when people are in need for out of pocket expenses to combat the dreaded disease called cancer. State of Meghalaya is unfortunately one of the highest detectors of mouth and esophagus cancer in the state. And we are taking administrative decisions to ensure that we are ready to face and combat this disease in its current situation. In the recent data that was collected in the state of Meghalaya, we see this rise, and this rise is what is very concerning to the state. Say the ICMR data discloses that we have as many as 176 cancer cases per 1 lakh population. That is big. Whereas in East Khasi Hills, it is also factual that we have registered and recorded 227 cases per 1 lakh population. The national average for cancer treatment, detection and others is about 100 per 1 lakh population. So we are way ahead of the national average. And government is committed to ensure that we combat this disease alongside attending to other diseases also. The non-communicable diseases, which is today becoming a threat, hypertension, heart, kidney disorders, liver disorders. All of these are better positioned in as far as our treatment is concerned. So yes, on this special day, I want to send out this message to people living with cancer. You are not alone. Government is with you. We will try our sincerest best to address individually, because as the theme says, it is a complex matter and individual concerns are unique in their own nature.
And also we have limited facilities out here.
So like I said, very often citizens themselves lack the trust in their own systems. Today, civil hospital on an average in 2024 has a total of 8,382 outdoor cancer patients. Of these, only in the year 2024, 1,649 new entries. And in radiotherapy alone, out of this entire total, 456 patients require radiotherapy. We have now upgraded the 50 bed to 90 bed, and we are preparing proposals to increase it to 200 beds. We are aware that we have technical issues of availability of specialized manpower. We are dealing with this, and we are also sending doctors to prepare themselves and get the correct training so that they can return to the state and address the shortfall that we have in the system. We are also concerned and talking to NIGRIMS. We have committees already set up. We are sharing information with NIGRIMS. We are constantly updating ourselves with sending patients from low income groups to nearer and closer facilities like Negrams. We have state-of-the-art operating facilities in Negrams. They can actually do specialized cancer surgeries with departmental specific requirements. One message that has to go out to the public: don't need to go too far. You can take the treatment in your own state. At best, we are in close touch with institutions like the GMC, the Barwa Cancer Institute, and the Northeast Cancer Institute, which are still within reach of the common man from a low-income group. Consult your cancer situation with your physicians and try your best to have faith in your own systems instead of reaching out to very far-flung places where your cost for cancer treatment increases 3 times, 4 times.
Ma'am, as you mentioned earlier, this type of...
So if I have to get into all the technical details, then I may go wrong, because I'm not a physician, nor am I an MBBS specialist to talk about it. But yes, we are trying to create awareness, which is the basic of all information. We are trying to we have banned consumption of tobacco. We have joined hands with Government of India and World Health Organization in publicizing consumables in the community which have cancerous effects. We are increasing our cost expenditure on advertisements. We are involving church forums, community forums, health organizations across the board, which is why today you will see that when somebody is told that they are suffering from cancer, that immediate deep fear is no longer there, because they know that the state and the nation is capable of addressing cancer treatment. All of the other Asian countries also come to India for cancer treatment. We've seen the numbers across the board through multiple institutions like AIIMS, plus private institutions like Gangaram, semi-private institutions like Medanta, like Fortis, Tata, Birla, and we're very grateful to all of these leaders in the business world who also dedicate institutions with excellence to these kinds of treatments, knowing very well that they are cost intensive.